In this case, we have a 39-year-old male with no past medical history who presented to the emergency room for complaints of cough for 2 days. On admission, he was afebrile, normotensive, and saturating 100% on room air. Chest x-ray was normal with no acute process, and the admission basic metabolic panel with repeat obtained approximately 2 hours later showed a significant metabolic acidosis with hyponatremia and hypochloremia as well. Arterial blood gas was obtained, which showed a mild respiratory alkalosis with a pH of 7.46, as well as mild concurrent metabolic alkalosis. This was not consistent with the BMP that was obtained, and the patient was admitted for further workup of profound acidosis. Because the patient was clinically benign, concern for erroneous laboratory data was suspected. The total protein and albumin globulin ratio was normal on the CMP, so a lipid panel was obtained, which showed a triglyceride level of 5,307. So the integrity of the laboratory testing machine was verified with contact with the chemistry department, and it was confirmed that it was calibrated and working appropriately. Throughout the course of hospitalization, the patient remained hemodynamically stable, with resolution of his cough promptly upon admission with antitussive medication. Chest x-ray was unchanged and remained normal, and the patient was deemed medically optimized for discharge after 3 days of clinically unremarkable findings, with the laboratory data presumed to be spurious secondary to severely elevated triglycerides. He was sent home with a statin. So in this case, we highlight a clinically and diagnostically challenging scenario of incongruence between clinical presentation and laboratory data. Hyperlipidemia and hyperparaproteinemia are two well-known causes of interference with laboratory data. And it is very important, of course, to keep a wide differential and rule out alarming conditions like toxin overdoses, and in this patient, potentially diabetic ketoacidosis. And then proper evaluation of high and normal anion gap metabolic acidosis should also be obtained. So some things that can be used to improve accuracy of the findings on the BMP could be high-speed centrifugation and lipid-clearing agents. And something that really raised our suspicion for erroneous lab data in this case was the discrepancy with the arterial blood gas. So obtaining an arterial blood gas is the recommendation according to literature when doubt is raised on the accuracy of any kind of metabolic acidosis.